It is indeed a great pleasure to bring greetings to the National Health Research Conference, the NHRC, on behalf of the Planning Institute of Jamaica, the PIOJ. Health and wellness is far more encompassing than physical health. It is the holistic integration of physical, mental, and spiritual well-being, while striving for optimal health. Jamaica has in recent years been plagued with a number of public health issues, pertaining particularly to non-communicable diseases, reproductive health, and mental health. The Economic and Social Survey of Jamaica 2022 indicated that approximately 27% of the population have at least one non-communicable disease. Evidence shows that the presence of NCDs is known to impact the quality of life and has been linked to the increase in the premature mortality rate. Data from the Ministry of Health and Wellness indicates that the premature mortality rate for the four main NCDs, cardiovascular disease, diabetes, chronic respiratory disease, and cancer, in 2021 was 21.1. We commend the Ministry of Health and Wellness on its ongoing efforts to combat the issue of NCDs, and we thank our international development partners for providing financial and technical resources in this regard. We use this opportunity to highlight the support given by the Inter-American Development Bank, the IDB, and the European Union, the EU, to assist in the implementation of the Health System Strengthening Program, HSSP, for the prevention and care management of NCDs. The objectives of the HSSP are to 1. Improve the health of Jamaica's population by strengthening comprehensive policies for the prevention of NCD risk factors, and 2. Implement a chronic care model with improved access to strengthened and integrated primary and hospital services networks that provide more efficient and higher quality care. The program will facilitate the upgrading of 3 hospitals and 10 health centers, leading to an enhanced experience for users of the public health system. The sexual and reproductive health of the nation's people is important and requires a holistic approach to ensure equity for all. The PIOJ is pleased to be a part of the Sexual and Reproductive Health Policy Steering Committee, which is tasked with overseeing the activities related to the development of a national sexual and reproductive health policy. This policy, which is aligned with Vision 2030, the National Development Plan, will demonstrate the Government of Jamaica's commitment to improving sexual and reproductive health outcomes and serve as a framework for the provision and delivery of sexual and reproductive health services. Approximately 2% of the population reported having mental disorders. These include depression, anxiety, dementia, as well as other types of mental disorders. The government has taken steps to address the issue of mental wellness. These include increasing the awareness of mental health and improving the accessibility of mental health services for all. Notwithstanding this, in an effort to enjoy complete health and wellness, individuals are expected to take responsibility for their own health. In keeping with this year's theme, Taking Responsibility, our health and wellness in focus, a concerted effort has to be made by Jamaicans to make better lifestyle choices. We need to eat a balanced diet, avoid food with high levels of sugar and sodium, be physically active, get sufficient rest, increase our water intake, and schedule regular health checkups with a physician. While we recognize the role of the government and medical practitioners in supporting the health and well-being of the population, a multifaceted approach is required. This approach must involve all stakeholders in order to achieve Outcome 1 of Vision 2030 Jamaica National Development Plan, a healthy and stable population. It is my hope that each of us will be encouraged to make health and wellness a priority as we continue to strive to make Jamaica the place of choice to live, work, raise families, and do business.